Hello, my name is Rahisha Gullich. I'm a student with Nightingale College. Today's video is an intramuscular injection video. So I received the provider's order, and it is to give the patient 6 milligrams of morphine IM times 1 dose, and what is available is 4 milliliter. I will then go ahead and gather the materials for the procedure, and then I will verify the 6 rights, the right medication, the right dose, the right patient, the right time, the right route, and the right documentation. Then I will go ahead and I will calculate the dose of medication that I will be administering. And for this video, it will be 1.5 milliliters times the 6 grams of the 6 milligrams of morphine. The 6 milligrams of morphine. 6 milligrams times 1 milliliter divided by 4 milligrams comes out to 1.5 milliliters. Okay, so now I will go ahead and introduce myself to the patient. Hello, my name is Rahisha Gullich. I'm a student with Nightingale College. How are you doing today? Great. Then I will go ahead and identify 2 identifiers, patient identifiers. Can I get your name and date of birth? And then I will match their name and date of birth with their wristband. Okay, perfect. Thank you so much. Do you have any known allergies, food, medication, seasonal allergies? No? Okay. No allergies. Then I will go ahead and inform the patient that the provider did order the medication morphine administered by injection. Okay. And I will then discuss the intramuscular injection and its actions, its uses, its common side effects, and I will go ahead and list them. Of the medication of morphine, I will go ahead and list them. Then I will let the patient know that they might feel some slight burning or stinging sensation while I'm administering the medication into the injection, and also to instruct the patient to notify me of any adverse effects, and I will list them. And then I will ask the patient if they have any questions. Okay, sir, do you have any questions? No questions? Okay, perfect. And then I will go ahead and perform hand hygiene and put on clean gloves. Oh, I will also want to note that I will go ahead and provide privacy. I will close the patient's door or curtain. So I will. I just want to notify that I provide privacy for the patient. I just want to make a note. I'm not sure if I said it, but I will let the patient know about the medication, its actions, its use, its common side effects. Side effects, and then I will go ahead and I will list them. And I will also want to note that I will make sure I check the EHR again, verify the medication, and verify the dose of the medication, and make sure I have the correct patient and all the 6 rights are followed. And then I will do the hygiene and put on my gloves, but I wanted to note that. I would like to note in my kit, I only received these and also insulin. Those are the only 2 insulin syringes and this one. So those are the only 2 that I received in my kit. So I have to use that yeah, I received a few of these. Um, and then also, this is the only, besides the two insulins that I received, this is the only other vial that I received in my kit. So I am using this for my morphine. So just want to note that these are the only needles that I received into my kit. This one, and I want to go ahead and notify the sizes, which is a 25 gauge and 1 milliliter. So as you can see, and I labeled here. Okay, and then I have 2 alcohol wipes, and I'm going to go ahead and I'm going to clean. I'm going to go ahead and take that and wipe the top off the alcohol pad. Okay. Okay, and so I do want to note that I don't have a 1.5 syringe. This is a 1.0 milliliters. So this is all I have. This is all that was sent to me in my kit. So I just have to use what I have. So I don't have a 1.5, but I will just act like this is a 1.5. So I just want to note that. Okay, so I will go ahead and I will remove the lid, and then I'm going to go ahead and fill the syringe up with the required amount of air, the same as the medication amount. So pulling that. So if it was a 1.5. Okay. And I just kind of went down to kind of make it seem like it's 1.5. Okay, so okay, so since this is a 1.0 ml, I'm just going to go down like it's 1.5. So I went a little bit down, but I'm just kind of improvising right about now. So I take my dominant hand with the syringe and my non-dominant hand holding the valve, and then going ahead and insert it. And then serving the air. And then I'm going to go ahead and flip over the valve and pulling the syringe back to get to 1.5. I really wish that I had the correct needle for this, the size, but I don't. I don't have one. So at 1.5, I'm going to go ahead pull that out and then safely sit that's in a clean area, protected. Okay, so now I will go ahead and get rid of any bubbles. All right, so I will go ahead and I got rid of any bubbles. So then before I will go ahead and check the EHR again, and just make sure that I got the correct medication, the medication dose again, and making sure that it's the correct dose and amount. Again, I don't have the correct size. So I'll put that aside. Then I will go ahead and locate the appropriate site. Looking at the integrity and the size of the muscles. I'm assessing for any skin bruising, skin irritation, edema on the skin. I will palpate. I will go ahead and I will palpate for tenderness. And I'm looking for it. If there's any irregularities, anything that's abnormal, I will avoid the area. And frequent injections rotate the site. I will rotate, choose another site. So I will then go ahead and relocate the site using anatomical landmarks and how to find using how to find using landmarks. For the landmarks, for example, if there was a stretch mark here and then a stretch mark here, then I will go ahead and have my site in the middle. So that's how I will pick the location of my site. Then I will go ahead and I will take an alcohol pad, and in the center, I will go ahead and start cleansing in the center of the site, and rotate the pad outward in a circular direction for about 5 centimeters or 2 inches of the area. Okay. And then I will go ahead and I will allow this to completely dry. I will not blow or wave on it. I will let it dry on its own. Okay, so the site is now dry. So I'm going to go ahead with my dominant hand and I'm going to hold the syringe in my hand, holding it like a dart. Okay, with my thumb and my 4 fingers right here, and I'm holding it as a dart. And then using my thumb and my finger with my non-dominant hand to spread the skin, I'm going to spread the skin. I'm going to go ahead and position, I'm going to hold the syringe at a 90-degree angle into the muscle. Okay. And just like this. Okay. And then I'm going to go ahead and take my non-dominant hand to stabilize it and move the dominant hand to the end of the plunger to avoid moving the syringe. And then I'm going to administer the injection. And I'm going to do it slowly. I'll pull back on the plunger for 5 to 10 seconds. If no blood or appears in injection, slowly at the rate of 10 seconds per ml. But I'll go ahead and now, once the medication is injected, and I'm going slowly. and then I will go ahead and smoothly and steady withdraw the needle and release the skin. I'm going to go ahead and throw this into, I'm not going to cap it. I'm not going to cap it. I'm going to go ahead and discard this into a sharp container. I'm going to do that. Sharp container, I'm not going to recap it. And then also I will go ahead and place a gauze gently over the site. Do not massage it. But just apply gentle pressure to the site, but I'm not massaging. And I discarded the needle and syringe into a sharp or puncture proof container. Okay, and so now I'm going to go ahead and remove my gloves and perform hand hygiene, and then I will go ahead and document the procedure and leave the patient in a comfortable position, and yes, and document the procedure. And that is it for this video.